with more on that. News 5's Jessica Bretto. Jessica, you are live in the facility and learning that timing is really critical with this vaccination.
Just listening.
Hey there, Bree. Yeah, timing is very critical, and as you mentioned, the Chief Medical Officer and also an ER doctor, Dr. David Steinbruner, he was vaccinated about 20 or so minutes ago. He's been here and he's been basically filling those 15 minutes of observation period. So how are you feeling right now?
Totally normal. I don't even know that I had a shot in my arm. I can't feel it at all.
Awesome.
If you didn't remind me which side it was, I'd forget. So.
Yeah, you didn't even flinch on air.
No,
so
literally. I wasn't trying to be, I would try to be tough on the camera, of course, but truthfully, I didn't feel it.
No, absolutely. And you also have that military background, so I can see why it wouldn't even faze you.
Well, we've been injected so many times, I forget now.
So what do folks need to know before they get their vaccine? Obviously, you've gone through the process. You were screened. Can you talk a little bit about that?
Sure. We were just basically screening to make sure I've not had allergies to vaccines in the past, like anaphylaxis, or to make sure I'm not allergic to eggs, or that I've ever had a bad reaction like what they call Guillain-Barré, where you actually have an ascending paralysis because of the vaccine. It's very rare, but we'd want to make sure nobody had that before we gave them this vaccine.
So at this point, more than 200 folks have been vaccinated. 400 plus people will be vaccinated today. And so far, have you seen any sort of reaction or anything like that? What do you look out for?
Well, we haven't seen any major reactions at all. And I don't think I've heard of anybody saying they've been particularly sick yet either. It's early. We expect some people to get some muscle aches, headaches, fever maybe, but none of that's occurred to my knowledge so far. And
then basically this is a 2-dose vaccine, so you will be coming back in 21 days to get that second booster. Can you talk about why that's important to get that second one?
Well, exactly. You can't guarantee that you're going to get the effects of the vaccine fully until you've had it twice, and that's how it was tested and that's how it works. The immune system gets an early taste of it, and then it gets it again, and then it cranks out a lot more antibodies at that point. And it has to be exactly 21 days. So logistically, all of these people have to come back on the 7th of January. They cannot come back on the 8th. They cannot come back on the 6th.
Do you schedule that second appointment during your first, just to make sure that the timing is exact?
That's the logistical challenge that these guys in logistics and operations and planning have been able to pull off. We have to be able to schedule everybody for the exact time at the time they do it through the UC Health app on the phone.
Got it. All right. Very valuable information. Thank you, Doctor. Always watching out for you, Colorado Springs. Jessica Bretto, News 5.